broadcasting live each week on Wednesday at 7 p.m. from Fishbowl Studios.
Log on to hear us speaking the facts on current events, family, and finances.
So be sure to log on each week on Wednesday at 7 p.m. to catch Speaking the Facts with Charlie and JR.
Tune in.
What's up, everybody? We are back. How you doing, family? This is Speaking the Facts with Charlie and JR. And, of course, I am JR. And my lovely daughter and co-host is over there on the other side. How you doing, Charlie?
Hey, Dad. I'm good. How you doing?
I am above ground, baby. It's a good day. No complaints whatsoever. At least none that y'all want to listen to. So. I want to go ahead and really quickly get a little bit of the normal things out of the way. Mm-hmm. I want to say that Speaking the Facts with Charlie and JR is brought to you by Kiss Wealth Now. Mm-hmm. Taking care of not some, not half, not most, but all of your commercial and residential real estate needs. So, Charlie, go ahead and tell them how to get in touch with Kiss Wealth Now.
So, y'all can get in touch with Kiss Wealth Now. You can call me, 214-738-4913, or you can go to my website, Kiss Wealth Now, all together. And today is awesome because our guest that we have on the show actually Kiss Wealth Now.
Yes, I did.
And so, right now, with up under the state of Texas, T-Shack, there's 3,000 loan officers, and out of 3,000, I'm number 6 for the program that I helped you with.
Yeah.
Yes. But yeah, there's somebody here who went through the program.
Yep, that was me.
We got real numbers. So, and as we always say, your health is your wealth. So, and that's another segue into you.
I always say that.
Into it. Yeah, I'm going to enjoy this.
Yes.
I'm starting Kiss Health Now because that will, and we'll get into the health stuff after we do the little the pleasantries.
Yes.
Kiss. See. I'm over here kissed now. See, Speaking the Facts with Charlie and JR is also brought to you by Top Notch Sports. Top Notch Sports is, I believe, still looking for referees and things, correct?
To help officiate the game.
To help officiate games. It would be high school games. It would be college games. And it would
Not
be
college, high school, middle school. Yeah.
Okay.
Yes.
So high school, middle school. You will get paid for doing this. There is training available. So if you are interested in becoming a referee officiating a sport up under Top Notch Sports, you can email us at SpeakNFacts altogether, SPEAKN the facts at gmail.com. You can call us at 214-738-4913 or 469-254-6470.
That's right.
And last but not least, I do not want to forget our alter egos, the Speaking the Facts team here. Kim came up with that name, the Speaking the Facts team. I like that. See?
I like that.
Yeah. So our alter egos, the fly guy and the fly girls. So I am. Don't call it a comeback because I've been fly.
That's right.
And over there is Fly Money.
That's right. Got your money.
Kiss Wealth Now. That's Fly Money over there.
That's right.
And we have the second Fly girl and the third member of the Speaking the Facts team, Kim, our producer, a.k.a. This Shit's Fly. What's up, Kim?
Hey.
So, she was a little loud today, huh?
Yes, she was.
A little bit, we're gonna get Kim in front of the camera one of these days, huh?
One of these days.
Well, we did get her in front of the camera
just
once.
one time.
Yeah, yeah. So and she was quick to remind us.
Yeah. That was last year.
We got Taylor over there on the knobs and faders. How you doing, Taylor? Yeah,
yes,
Taylor is smooth and soft as usual.
Yes.
But without any further ado, because I'm looking forward to this conversation, I want to go ahead and let Charlie here introduce our guest.
Okay, so our guest, who is awesome, she's a mom, she's a nurse, she owns her own business now, and in her fun time, she likes to roller skate. I got to get back to doing it. It's just good exercise. I miss it. And so, but today you're coming in to talk about, I don't want to say home health, but really helping people with maybe pre-need and making sure that, that they are comfortable towards the end of their times, right?
What I want to talk about today.
Well, then look here.
What name first?
Oh, Jessica.
Yes, I'm Jessica.
And what you gonna talk about today?
AKA J Money. No,
I know. Well, I like that.
That's my alter ego.
J Money. Yes, I like that.
Yes, but what I really want to talk about today is nursing. I want to talk about Black health care.
Yes.
as a nurse, I've seen a lot within our community. I really want to talk about Black healthcare and also brown healthcare, Hispanics, what I've seen so far, because there are some things that I'm seeing in healthcare that really alert me, and we need to educate our people on. Is very important.
Yes.
And health is wealth.
Health is wealth,
Yes,
yes,
it is.
and just you have there was a guy, I don't remember his name, but I know that he was. A lot of people were, of course, on Facebook, you get to see it all, but for all intents and purposes, pretty healthy guy, and he, I think, had a heart attack. But again, and not to say that he didn't know, but there are signs out there. Sometimes we just overlook them. And I think heart attacks are probably one of the biggest things for brown people that take us out of here more so than any other thing. So what can we do for our heart health so that way those things happen less frequently?
I'm glad you asked. So
Yes.
what is the number one thing that we should be doing every year?
Checkup.
That's right.
Okay.
Annual checkup. We should always have an annual checkup. We need to check our labs, which is what the doctor is going to do. So let's start from the very basic checkup. You need to choose a primary care physician. And speaking of physician, well, now we say providers. So you have your doctors, you have nurse practitioners. They can also do annual checkups.
Right.
And you have physician assistants. So those are your healthcare providers. They can do those things.
Right.
You start with your checkup. If the doctor or your healthcare provider notices anything that's out the ordinary, then they may refer you to a specialist or a cardiologist. They'll do imaging, maybe CT scans, MRIs, further workup for you if they notice something.
Gotcha. And that's important because I like how you mentioned providers because, you don't just have to go to the doctor. You have your nurse practitioner and then you have your physician assistants that are able to do the same thing and normally at a cheaper cost, right?
Yeah.
So, if a person doesn't have insurance, they may be able to get a physical, and if I'm wrong, but, maybe the doctor may cost $100, but that nurse practitioner or that physician assistant, theirs may be $50. It's just, obviously it's just but I guess it still carries the same amount of weight. Is it the same amount of insurance that's required as far as
So when we speak about insurance or just
paying out of pocket?
Paying out of pocket, I would say, so you have your insurance, you're still going to have a copay. That copay does not change whether you see a nurse practitioner or a doctor or PA. It doesn't change. If you're paying out of pocket, this is where it gets tricky, where you're like, okay, well, I don't have health insurance, but let's say there's an emergency. I need to go to the urgent care emergency room. There's a vast cost.
Yes.
I've
Yeah.
had emergency bill, and I was like, oh my gosh.
Yeah, no, I know.
I don't
exactly.
know, I don't know what I'm
Yeah.
going to do.
Yeah.
But I paid off a long time ago.
Yeah.
However, the cost may vary.
Right, yeah. I know because I've gone to a 24-hour emergency because I thought it was going to be quicker than the hospital, and it was, but the bill was triple the amount if you went into the hospital. And you're just like, oh my gosh. Yeah, so I've had that, like the sticker shock, and it's like, yeah, I'll wait. But then, we probably, if it's very urgent, we probably don't need to wait.
Which is kind of the part of it I want to get to, because we're talking about we're now we're at the end. We're discussing, getting having an emergency or going to the doctor. But I really like to focus on staying away from the doctor. I mean, not getting my annual, because I do get my I do go get my, I just had lab work done, so I
Okay.
do that.
Okay.
But and actually, I found out that my blood sugar had reached almost 6, which
Oh, wow.
which wasn't, it's just not devastating, but it had gone up a little bit. I would not have known that had I not had some lab work done. So I'm getting it back down, eating more and more green stuff. I'm a vegetarian anyway, so I am really about optimal health. I like to use that term because it's taking care of the body, taking care of the mind, taking care of your of your spiritual self.
Right.
Just so that they are they're dancing and singing together.
Right.
And to be my age and be fairly healthy is great. I mean, I can't tell y'all enough how nice it is not to. And I was headed down that way, where had to. I think we looked at some pictures of me from a while back, when I look at see where I had the inner tube on that was not, I couldn't take it off. It was attached, and
Right. It's my body, and I'm standing beside it.
yeah, that's right. Yeah, but I didn't like either one of them though. But yeah, just being watching, getting some exercise, watching what you eat, the basic stuff that's gonna help to minimize those trips to the emergency room, or even being a slave to prescribed medicines. Because I can tell you it's possible not to be on them. I'm 68 and I'm not on any prescribed medicine of any
That's
kind.
great.
Yeah.
That is awesome.
Yeah. So and of course I do take vitamins, and I do take a few supplements that are kind of tailored to my body and what it needs. But yeah.
And that's where checkups come into play, right? Because if you go
Right.
to doctors, and you go every year, so they're able to see what's normal for your body.
Right.
Right.
And that helps helps out too,
Right.
because if you go one time, they really don't know they have, I guess, what's charted for normal, but maybe not what's normal for you, obviously.
Yeah, so there's usually a standard range of lab values, and once we see those values that are like low or high, the doctor will then decide, okay, maybe I need to put you on medicine. So you mentioned A1C.
Yeah.
You want to tell people what that is? What's A1C?
Well,
Pop quiz.
Well, pop quiz. Well, your A1C has something to do with your blood sugar, but I don't know exactly what it is.
And if it's bad, then what?
Well, if it's bad, then there's two choices. They're going to want to put you on some medicine.
Yeah.
Like I said, my thing is not to let it get bad. That's why But what is it? What is A1C technically for me and for our
Okay.
viewers and listeners?
So keeping it very basic, A1C is a measurement of how much sugar is in your blood. That means if it's too high, we're looking at diabetes. We got pre-diabetes or diabetes. Diabetes is I'll tell you this. Okay, so I have 2 degrees. My first degree was biochem, and then of course,
STEM.
and then my second degree, of course, was nursing. I
Right.
took a virology class, and it said, not the book, my teacher, she said diabetes was worse than having HIV/AIDS, because diabetes, you're literally trying to live on a daily basis. You have to check your blood sugar every day to make sure, is it too high, is it too low? If it's too low, you can end up being in the hospital.
Right.
If it's extremely too high, you can still go back into the hospital. So
Right.
it's something that you have to measure on a daily basis.
Right. Yeah.
That's an interesting.
It makes
Yeah.
you wake up
Yeah.
because diabetes is something that definitely does affect the brown community. And I would like to point out just you don't have to be 600 pounds to have diabetes. You can be 90 pounds and have diabetes.
Yes.
You
So
can be
a lot of
13
people
and have diabetes.
You can be 13 and have diabetes. Yeah. So it doesn't discriminate. And that being said, obviously, if it's too low, people go into comatose states, and sometimes their body can't respond from it. Or if it's too high, then they get into stroke levels. But high sugar leads to a lot of other things within the body.
Yes. So let's talk about like the top 3 diseases
Okay.
for African
African
Americans.
Americans and
Do you know what they might be?
I would. Are we saying men and women together? And is there a difference between
I would say there might be a difference in between, but just in general.
I would say CHF, congestive heart failure.
Well, I was
Okay,
going to say
so-
heart disease. Yeah,
yep.
would be one.
Heart
Yeah.
disease is actually number 1.
Okay, good.
Yeah.
It is. Ding, ding, ding.
I'm studious.
Yes, number 1. What's
See,
second?
I'm thinking men, but I'm just thinking like colon cancers and stones and things. I don't think
That's number 3.
So okay.
Colon cancer?
So
Okay.
first one is heart disease. That's the top disease for that we tend to get. And then second is diabetes. And then third is cancers,
Okay.
prostate cancer and black men.
Yeah.
And Hispanics, it's almost the same. For them, I'm looking at my notes. I don't mind looking at my notes.
Right, it's okay.
For Hispanics, it's diabetes is number 1. and then cancer,
Number two.
which I have been seeing a lot of in Hispanics. It's number 2, and then number 3 is diabetes. So we're it's almost the same.
Yeah, it's almost the same. And so I think the uptick. They were talking about the uptick of colon cancer right now, and just across the board for everybody that they're seeing a lot more of colon cancers. And so I know there's probably many different reasons, but is there something, because we all use our colons. I mean,
Yes,
it
should be.
I know, right? Exactly, right? There's alternative. You can have a bag, but are they linking it to, obviously what we take in, but is there something that we can do to ease that, those numbers? What's the studies saying?
Well, what's the number one thing that we want to do?
Checkup.
So checkup, but also a colonoscopy. And usually those are recommended at a certain age.
I might be in that age.
Yeah, certain age. So I used to work for a lab, and if they do find anything like in the colon, they will snip. So like sometimes they'll see something called like a little polyp.
Polyp, yeah.
It's just a little round thing that's hanging off, and they will take it off with a scope. I guess it has a clip, and then they'll send it to the lab. They'll put it in a special solution, and then the lab will put it on they'll do the processing, and then they'll put it on a microscope slide. It goes to the pathologist, which is we call the doctor's doctor.
Right,
Because they look at the microscope all day long. And they'll determine if that's cancerous or not.
Gotcha. And so one thing that, because I was looking at it and I've come across it, and and of course I'm reading, but one of the things that, I guess I don't want to say a precursor or would alert a person that maybe they would have colon cancers. They say the biggest one is just the change of the stools, right? Just
It could be.
Yeah.
It could be changing stools. And
a BM.
yes.
We're going to use fancy terms.
That's like nurse terms, BM. 'Cause, and that's what we ask our patients every day. Have you had a bowel movement today?
Yeah, exactly.
One thing I want to, since you're talking about that, like changes, so let's talk about when we go back to the annual checkup. Well, I think it's really important for the annual checkup is to ask questions. Some people may not know what questions to ask. If you have any type of change in yourself, like you notice that you got this back pain, it's just been nagging for months or years.
Right.
Or you could be like, oh, sit down, I got this pain. Or you could have a pain after you eat or something like that. Don't ignore those pains.
Right.
It's very important. There have been stories where patients have ignored those things and then come to find out they have stage 4 cancer.
Very
Yeah.
big.
That's very true.
To ignore, and we talk about that all the time. We just ignoring your body. Your body will tell you what's going on, or it will try to tell you what's going on. It'll kind of, hey,
Yeah.
But do you think that there is, because like you said with Hispanics that diabetes was number 1, and I know that the general Hispanic diet is lots of sugar and fat. Where what I'm saying. So do you think that diet has something to do with the 3 causes of death that you just or disease that you just mentioned?
I think so.
Yeah.
Because that's the first thing that comes into our body is food.
Yeah, nutrition. Your nutrition.
It's food,
yeah.
nutrition. So if you're eating a lot of fatty foods, if you're eating a lot of sugary foods, sugar.
Right.
So
And there's certain
it's
things
just
that turn
kinda-
into sugar anyway.
Yeah.
It's like potatoes or
Rice.
rice, things like that. So people have to be mindful of those things because you may think, okay, I'm gonna get a couple of pieces of candy. That wasn't too bad. But now I'm gonna go eat a big baked potato, or I'm gonna get a whole big thing of rice, and that's a lot for your body
Well,
too.
and the reason, and another reason to eat manageable meals is
Right.
because anything you eat, I don't care what it is, anything you eat, if it's not, if your body hasn't processed it in 15, 20 minutes, it's turned to sugar. I don't care what it is. So that's another reason to eat very, very, eat manageable meals and not eat to get. Again, I am just so thankful that being my age that I can get up and I can move because, as we, there are foods that breads. Because the same yeast that they jam into the bread, same thing it does to the bread, it does to us. It makes us swell.
But it tastes so good.
Yeah, I know, but I'm, but
I love bread.
I know. I
did you see
know.
did y'all see their faces when I said bread? They were like, "You're gonna make some bread."
I know,
I like
right?
the Hawaiian rolls.
I know, right? Some, yeah, like all the breads.
I like
you
the
know.
tacos.
Well, let me
Cornbread.
say for the record that I do eat bread. However, I might 2 slices a day is maximum. And as far as all the sweet breads and all the no, because
Yeah.
and the other thing is just eating stuff that's going to help our organs repair themselves, help our organs to stay healthy.
Right.
I was talking to someone earlier and about a pain that he said, well, it hurts to do it, and I said, well, doesn't it hurt not to do it? I was talking about moving. I said, well, doesn't it hurt not to move?
Yeah.
He said, well, yeah. I said, well, okay, then
And you can't afford not to move.
Yeah, it didn't hurt for moving, not from not moving, because you not only are you in pain, but it's like driving over a highway. You drive over a smooth highway, you can go 200 miles an hour. But as that road gets rough, the rougher the road gets, the more you have to slow down.
That's right.
And I have found that it's the same with our nerves and our nerve endings and our tendons. If they're not getting the nourishment they need, the nerves begin to get dry. The tendons will get dry, and a lot of these pains that we get in our back and in other places is those nerves can't send signals anymore.
Right.
And they start to break down, and then we start to lose movement. We start to lose things. So just eating right. And I know y'all. I know how food out. I want my food to look good and to taste good and all that too. There's a side of me that does, but the greater part of me wants to be healthy, because it's food will kill us, and the people that make all this stuff and put it on the shelves know that. Food
is probably the harshest addiction, because you need it to survive. But I think that people need to flush their bodies, and I think that's kind of go back to water. If you eat bad and you don't drink water, it's a double whammy. I think we have to hydrate our bodies and get our checkups, but hydrate our bodies and try to eat right, so therefore your temple can go, could run this marathon, however long you got. Everybody has an expiration date, but you definitely don't want to shorten it, with something that you could have prevented. So with you, do you, like you're seeing a lot of cancers and things like that, are there any resources that you know of that a person, because I feel like a lot of people don't go to the doctors because they don't have sufficient insurance, right? So are there any resources that you can maybe recommend to someone who doesn't have insurance? I know there's Parkland and different things like that, but are there any other programs that people could utilize to get that checkup?
So I would say, like, if you're low income, start with the state level, like Medicaid, Medicare, that sort of thing, see what you qualify for. And sometimes people are caught in a loop where they have to get their own insurance. And I'll give you a clear example. When I was in nursing school, I actually had quit my main job. I'd saved up some money so I could go to school full time.
Right.
And I still worked on the side at Amazon, actually. Shout out to Amazon. Thank you for those fixed time shifts.
Yes.
And so I had to get was it Obamacare? But that was still expensive. But
Right.
I had insurance for myself.
Right, yeah.
At that time, my daughter, because I was technically low income, my daughter qualified for it, but I didn't have any insurance. And that's so hard,
Right, yeah.
like how I can't get that insurance, but she got it.
Right, yeah, exactly. Yeah, that's true. That's very, very true. So what are you, obviously, being in nursing, you're familiarized with, Western medicines, but there are people out there who like the holistic approach, so do you have people that maybe come in and, are doing the holistic things and say, okay, I got to go ahead and go with Western medicine, or flip-flop, what is your take on that?
I haven't seen much of like, I would say, where they're saying, oh, I'm practicing this, but I'm coming in here doing this. hospitals do have to, we will ask, and it should be part of most hospitals, they'll ask, do you have any religious belief or cultural practices that we can be aware of and mindful of? And I'll give you one example. One is called cupping. I know it's from an Asian culture, but you might have seen it on TV. It looks like it's bruises, but it's
Right.
not. They'll take a cup and it's like hot, and then they
Right.
just cup it all over you.
Right, yeah.
So,
Yeah, it's supposed to.
yeah, we'll see something like that. Jehovah's Witness, they don't do blood transfusions, and they
Right.
have a right to. That's their religion.
Right.
So we abide by that.
Right. Okay.
So if I were just, I come into you and I say, I want to do better with my health. What kind of roadmap would you give me if I just came to see you and I just said, I know I can do better. What would you diet, exercise? Would you tell me to a combination of both? Both would you? And does your blood type or your labs have anything to do with what you would recommend and that kind of thing?
So one, I want to talk about scope of practice. I'm a nurse, not a doctor, not MP,
Okay.
not
Yes.
PA.
But yes, I understand because
Yes.
when I was a
I love it
paralegal,
too. Scope of practice.
When I was
Number
a
two.
paralegal and we talk about law, well,
Yes.
okay, I'm a paralegal. I'm not a lawyer. I had to always say this.
Yeah,
So I
yeah.
understand.
But number two, I can tell you, foods to eat, nutrition wise, always, try to follow your doctor orders. And let's talk about that. So, if let's say that you leave the hospital or you leave your checkup and your doctor put you on the medicine, you need to make sure that you understand what they said. You need to understand what is this medication, what is it for. If you want to know how it works, go ahead and ask your provider that. Ask them. You say, well, how does this work? I never took this medicine before. Or they might add a new medication.
Right.
That we're talking about when you leave the hospital or when you leave your doctor's office.
Understand that. That's important.
You need to
That's key.
ask, what is this medication for? You can go and ask, how does it work?
Right.
How often do I need to take it?
And take all of it.
What are
Yes,
the side effects?
if it's antibiotics, please take all the antibiotics because your body can, if you don't take them all, your body can get used to that particular antibiotic, and then when something severe happens, we like to start out low, like the lowest level of antibiotics, but that's not good for the body if you don't take all your antibiotics.
Right. And so is that so? I know a lot of people, don't believe that medicines have expiration dates, So a lot of times people don't take them all because, I got some for later, but, it does have a shelf life and it will not, do what it's intended to do if it's expired.
Yeah, because expiration means like it's going to wear off, or depending on, the medication, it may just stop working. I'm not a pharmacist, but,
Right.
that could make a difference in what's going on, and especially if you have like maybe weak immune system or special like heart conditions, sort of that type of thing.
Yeah.
So we still want to be careful. When I say ask questions, I want to talk about the hospital. If you ever, whether it's you or a family member, and let's say that heart disease, you didn't keep up with it, you didn't keep up with the meds, and now you're in the hospital, or something else is going on. I think it's really important to have family there or a friend
a
there
support
to act.
system, yeah.
The reason why, and you can, when you're there, as a nurse, we'll ask, can we speak in front of your family or friend? And, you have to give us permission. They'll say yes. But it's good to have someone there to advocate for you. Of course, as a nurse, I'm going to advocate for my patients,
Right.
for sure. But sometimes, I've been a patient before as well, but sometimes you may not think of something to ask.
Right.
And I find that I really like when patients have family.
Yeah.
However, even though there's some family present, I'll pop quiz them.
Yeah.
I will. They be watching me take the vital signs, and they were like, "Oh, well, what is it?" I'm like, "Oh, it's 130 over 80." I'm like, "Oh, okay." I say, "Well, and I've done this twice. I've asked them. I said, so what's the normal blood pressure? I don't know. What's the normal heart rate? I don't know."
Right.
So
Well, I know what the normal blood pressure is now. Heart rate, does that depend on your size or your age or any of that? Are there?
it can. As we age, our normal values are going to change. So, for example,
Are they going to get weaker? No.
so
We're
like,
checking up out of here. Slowly but surely.
Hey,
like-
I resemble that remark. Why-
I know, right? It's like when you're young, your heart rate is 120. It's just fine. 120 and you're
No.
80. I'm
No,
teasing.
no.
I know.
that was terrible. You supposed to see
my
that challenge on her
gosh.
face. She was like,
No. 110? No, go ahead.
So what is a normal heart rate for a 35-year-old then?
So normal heart rate for an adult is 60 to 100 beats per minute. When you exercise, of course, it's going to go up.
Right.
When you sleep at night, it's going to go down a little bit, maybe
Right.
like 60, maybe 50. And then as we age, okay, let me go back to blood pressure too. Blood pressure, usually you hear 120 over 80, maybe like 130. But once you get in 140s, now we're talking about
High.
getting into hypertension.
Yeah.
What else? With blood pressure, it's our arteries and veins. And those are going to deteriorate over time. They're going to get weaker over time. However, again, it goes back to what we eat and our physical health. And it's recommended that we get at least 30 minutes of exercise a day, something that pumps up the heart.
Right. And to get the blood flowing. Yeah.
Yes.
Yeah.
Exactly.
Which is I wouldn't be able to move if I didn't do, I do yoga and I
That's
combine
great.
yoga and stretching and I'll get on my iron gym a little, I'll pick up a few weights, but I kind of do what my body tells me to do, because if I get up one day and it's like, oh, well, there's a crick right here, and my body kind of tells me what exercises to do, and I've learned to listen to it. So, but yeah, getting, again, keeping those, and with exercise, I find that most people want to go to the gym and because they want to see the big muscles, but it's, those muscles are attached to tendons, and rotator cuffs and things, and those things need to be strong as well, not just the muscle itself,
Right.
which comes back to your diet, how you nourish those things.
Yeah, well, there's a guy on all over the internet. I've seen him. He's not necessarily a big muscle bound guy, but he's super strong. Like he'll have 1,000-pound mop and he can pick up, but he's like a little small frame. So he'll go into gyms and act like he's sweeping and stuff, and he'll pick up, 500 pounds with no problem. And people are like, oh my goodness. And then people will grab the mop and they can't pick it up. Like everything's heavily weighted, but he's a small frame. So yeah, being healthy, you really can't judge it by the size. I think that's probably one of the things, because a person can be really small and be unhealthy, obviously,
Oh,
and
yeah.
to the other extreme, your body type is your body type. Trying to get back to, where we started, but, the checkups, hypertension, cancer, and congestive heart failure. And, one thing I think in the Black and brown communities is that we can be very secretive. Not all of us, but we can be very secretive. We don't want people to know about our finances, and we don't want people to know about our health. I've had a lot of people say, well, I didn't want nobody to worry, So maybe they didn't tell them that they were sick, or they had diabetes, or they had high blood pressure, or they have all these medicines. How can a family member, and of course it's a suggestion, but how could a family member kind of suggest to that for themselves, or to their kids, their parents, or grandparents, hey, let me know what you're taking so I can help you out.
Okay.
How would somebody go about that? Because like I said, it's like a real private thing.
It is
for a lot of people.
I could have a little suggestion. We got to let everybody.
Okay.
Most people want to tell you how to grieve. They want to tell you how, you should be done with this, or you should be over with this, or you should be whatever, but if just like, and I Chase, the guy that I sang with, same thing. He didn't tell us he had cancer. We found out at the last minute before he passed away. Then I didn't want nobody to worry. But if no matter when you get sick, I don't want you to worry. So I'm not going to worry a whole bunch in front of you, but just like I have to allow you to go through what you're going through, allow me to go through what I'm going through, allow me as the caregiver or as the relative or whatever I am, allow me to deal with the moment so that I can get through it too, so I can help you.
Right, yeah.
You know what I'm saying? So in the long run, it doesn't help to be secretive because you're really not allowing that person their part of the process. They're going to get involved eventually anyway.
Oh, yeah.
Yeah,
I'm
yeah.
so glad y'all brought that up.
Yeah.
So, this is usually discussed in the hospital.
Right.
One of the admission, like when someone gets admitted to the hospital or I'm like a med surg floor, we ask them some questions. We ask, do you have a medical power of attorney? And do
Yes.
y'all know what that is?
I
Y'all
know.
out there,
Yes.
do y'all
Yeah,
know what that
yes,
is?
yes, I know.
Yes.
Yes.
Okay.
Yes.
There are different power of attorney for different things. You can do a blanket one, which I would advise most people to do. But you can
You
get
said
one.
wouldn't advise?
Yeah, no, would not. A blanket one that gives a person, they're like your executor at that point. They can do anything.
Everything.
Yeah. So
Mm-hmm.
you wouldn't really want that unless it was absolutely necessary. But a medical power of attorney allows that person to make medical decisions
Mm-hmm.
for you.
Yeah. Yeah. So, yeah, that is exactly what it is. And it gets pretty real when that patient is in the ICU.
Right.
And I have worked in the ICU. I have seen where, when it came to that time, we had, brother and sister fighting over, no, we don't want her to be
Incubated or
intubated, or we just want her,
Yeah.
those type of things. And so I think that it's important when people are planning their family estate, like wills and trusts, that sort of thing, that they need to include medical power of attorney. It does mean that you designate someone, it could be anyone.
Right.
It can sometimes, even if someone's married, they can still have a medical power of attorney and have their dad carry out their wishes of how they want to
Yeah.
die, or
Right.
what they want in the hospital.
Exactly. Yeah, because if they're treating you for whatever and it causes this or causes that, if there's not anything in place, the hospital is just doing the care as they normally would.
Right.
One thing, if that person is, there and the people are arguing, what have you, how does that, I just think it's just a big thing for us again to be okay, because we think about only one that would have full autonomy over us would be God, right? And so to go to a family member and say, hey, if I'm getting ready to check up out of here, you get to make the decisions. People don't want to talk about it. It's just an uncomfortable conversation. Nobody really wants to talk about when they leave and how they're leaving. Are there, and I keep going back to resource, we are talking about it, and hopefully we're helping people talk about it. And maybe somebody will say to that loved one, hey, let's talk about, what you want or how you want it, I tease and to tell my family, when I pass away, cremate me and go to the mall and spread my ashes over the mat counter, and they say nobody's going to jail for me, but maybe I'm just going out on a limb here, but maybe there needs to be that a get together. I don't want to call it networking, or where people, a person comes in and says, hey, it's not as bad as it seems, that way you're taken care of, because at the end of the day no one wants to be sick and by themselves.
Right.
Or not understand what's going on, or the family not understand what's going on. And because things do move quickly in a situation when you're in the
especially in the ICU.
Yeah.
Yeah. And speaking of, the medical power of attorney, did you all know that when someone goes to a hospital that they can choose to be a DNR? Do y'all know what that
Yeah,
means?
do not
resuscitate.
Do not resuscitate. Yes.
Yeah.
So they have that option. There's so many options where you have, if you don't want CPR done, or if you don't want to be intubated, those sort of things. So
I'm going to share that. I used to be a CNA. Did you know that?
no.
That's how I know a lot of these terms. When
Yeah, BM.
Yeah.
Did you try that BM? No.
Yeah, I know, right? Yeah. I'd like to report. No. So, I worked actually in a nursing home, and I worked on an Alzheimer's unit, and then I worked, I don't want to say like a special care, but like people with that were awards of the states, where they had disabilities and their families just couldn't take care of them. And so I did that, and I learned a lot. I actually, before I became a CNA, I got accepted into the Pima Medical Institute, and it was going to be a whole lot of money, but I scored very high, like off the charts for my dexterity. So I could have, my numbers were high for me to be a surgeon. And I thought, and at that time it was $100,000. I'm going way back, for the complete program. And I thought to myself at that time, I said, well, let me go be a CNA and see if medical is really what I want to do with my life, And I did, and I'm glad I did it that way, because I love people, but I just realized that when a person's hurting and things like that, I really take that in, And I remember the first time I worked on a dead body, I was like, oh my goodness, it's just, it's just, I mean, you get used to it. And I just didn't want, at that time, I was like, I think I want to do, I was young, I was like, I think I want to do something a little bit more fun.
Which I want to acknowledge, give you some flowers for a moment because, I have worked in and I've never been in the medical profession, but I've been like a mail-in med person in the hospital where I had to deliver mail-in meds and going into psych units and all kind of different things and it takes a person because that it does pull on you and but you have to be able to
shake it off
and be pulled on and shake it off and then be pulled on and shake it off and that's a gift that you have. It really is. So that's why I want to commend anyone any nurses or anything. That's
you are essential.
Yes. So really quickly, how do you deal with that aspect of it? How do you deal with the this sickness and death and keep that smile that you that you've had the whole time you've been here? So
you have to have some real empathy and put yourself in their shoes.
Right.
I would say if someone that's going into the medical field and they haven't experienced something, like if they haven't experienced death in the family, like close up or like anything wrong, it's kind of hard to relate. So
right.
I've had family members die. I've been in the hospital as a patient once where, in fact, I tell the story sometimes because I wouldn't be here if it's so weird. If I would not actually be here, if a scientist didn't tell me, because I used to work in a lab, if a scientist didn't stop me, say you need to go to the hospital, if I was supposed to go get an MRI. So I'll tell you the story really quick. So, okay. So I woke up early in the morning and my stomach was huge, like it was huge and it was hurting. And so, I thought I was constipated. I was not.
You're self-diagnosed.
Like, I'm constipated. So I went to work. I was still in pain. This was a pain that I was trying to ignore. Shame on me.
Yes.
And then I went to work and then still thought nothing of it. And then I walking down the hall, scientist, I don't remember his name, and he was like, you don't look good. He said, you need to go to the hospital now. So I made that decision to leave, and I went to doctor office. That doctor office was great. They had MRI, they had their own lab and everything in there. So she gave me the PA as a physician assistant. She said, help save my life. She said, okay, I need you to go get an MRI stat. So I went downstairs, went to go get the MRI. They said, oh, no, you got to come back tomorrow. I walked out, and my physician assistant is coming. She said, you leaving now? I said, yeah. She said, no, I had ordered that stat.
Right.
She walked me back in there, and she was like, she needs this MRI right now.
Right.
And I was just going to pick my daughter from daycare, and got the call. She said, I admitted you to the ER. You got to go right now.
Right.
You've got appendicitis and a twisted colon.
Oh, wow.
Yeah. And I guess if I didn't make that decision to go in, I wouldn't be here. This is before I was a nurse. I wouldn't be a nurse at all.
And let me just say that again. Listen to your body. We've had a couple of guests on the show that one guy that went to buy a car and had a heart attack.
Had a heart attack
at the dealership.
At the heart,
and then our brother and friend Bass, he came on and like the same thing.
Yeah.
He went to a doctor for something totally different, and it was like, oh no, you ain't leaving, and your blood sugar is off the charts, and so listen to your bodies, really listen to them because they're trying to tell us what's going on. You got to take time, turn off the noise, just kind of sit with yourself, get to know yourself.
Meditate.
Again,
And I think that again it can be scary, but when you don't know what's going on with your body, but it's just important to talk. So anybody out there, if somebody says I don't feel good today, tell them to go to doctors. I don't want to say like you're a hypochondriac, but if you sneeze more often than you normally do, go get it, check it out. You know, if your eye starts watering more than it normally does, go get it checked out.
Yeah.
You know,
Yeah, if you have a fever
you're
for more than a couple of days, go get it checked out. You know what I
Right,
mean?
yeah.
You know,
yeah.
if you
But we
have a
don't want.
fever
And then I think we had a friend who her stomach had swollen up, and she was having issues, and she was taking medicines for it, and she had cancer, and it was too far gone. You know, it's like you get heartburn every day. Go get. I mean, and these are, and we're talking about just normal things. You know,
Yeah.
Right.
most people get headaches every day. You get a little heartburn. You may have extra gas. You know, a cramp. You know, a pain. You know, it's just definitely
if they
get it checked.
persist at all,
Yeah.
get it
Kim.
checked out.
Yeah.
Kim, call Trey.
So, I get the clock on the wall is saying it's about time. We don't have to go home, but we do have to get the out of here. So so what general advice would you give to someone? Just because we talked about the black and brown people, what do we need to do to be more healthy in general?
To be more healthy, it starts with a checkup. Get your annual checkups. Number 2, exercise, eat well. Resources for that is go to the CDC. CDC about nutrition.
I didn't think about that. You can go to
Yes.
CDC site and it'll tell you.
CDC, the WHO, World Health Organization, start there. And then next, you have to do your part.
Right.
You have to do your part. You have to make small habits to change those things out, and you never know. You'll probably see those changes over time.
Right.
Let's see here. Number 3, if you go to hospital, bring family with you. That's what I did once I had my surgery. I
Right.
made sure I was headed to the hospital. I called family and friends. They
Right.
came.
Right.
That way you have some advocates there.
Right.
And I also want to talk about really quick is diversity in healthcare. We need more diversity in healthcare. In my nursing school class, I think, the only African American girl, only African American woman in my nursing class.
Right.
And so when my black patients see me, they're surprised.
Right.
When they see me put my stethoscope on them, they're actually surprised. I've had a patient that was surprised that I put my stethoscope on them when their own primary care physician did not. So it's very important that you ask questions. What does my normal checkup look like? The doctor or provider should be checking your heart, your tummy sounds, your lungs. They should be doing a full assessment on you.
Right.
And if you feel like something's not right, you can always go get a second opinion.
Right, for sure. Yeah, definitely get that second opinion and take the time. Definitely take the time to do it.
Yep. We unfortunately have to get out.
We have to get out. Somebody's screaming. But thank you so much, Jessica, for coming and
Yes,
sharing that,
Jessica.
because it's a
Thank you.
conversation that needs to be had, and just some of the things that some of us may know, but we need a reminder. We
Yeah.
definitely need to get a checkup. We got to schedule ourselves in.
Yeah.
Self-care is not just going and hanging out. It's also taking time to go
Yep.
get that checkup. So
Yep.
thank you for that reminder.
You're
And by the
welcome.
way, really quickly, if you want to be a guest on Speaking the Facts with Charlie and JR, send us an email, speakingthefacts@gmail.com. Like I said, SPEAKN, the facts all together at Gmail. Our lovely and proficient producer will send you a calendar and have you
Yes.
book yourself a date.
Book yourself a date. Yes.
That's right.
I know October's full though.
Yeah,
Wow.
or just about.
Yeah.
So which is good. So anyway, thank you for hanging out with us. Thank you TikTok family. Thank you Facebook family. Thank y'all. Thank all y'all. Thank y'all for hanging out with us. We'll see you next Wednesday, same facts time, same facts channel. And
Yes.
until then,
Love yourself so you can love somebody else.
there you go.
Bye, y'all.
We'll see y'all later.
Bye.
Hey, this is Charlie,
This is JR.
host of Speaking the Facts with Charlie and JR, broadcasting live each week on Wednesday at 7 p.m. from Fishbowl Studios.
Log on to hear us speaking the facts on current events, family, and finances.
So be sure to log on each week on Wednesday at 7 p.m. to catch Speaking the Facts with Charlie and JR.
Tune in.
Hey world, this is Jamie, host of the Jamie and Genty Show, broadcasting live each week on Tuesday at 12 p.m. from Fishbowl Studios.